Good day, folks. Thank you for joining us here at Your Health. On today's program, we will be taking your calls for the entire hour, and I really do look forward to hearing from you. I hope we can set you onto the path of wellness today. But first, let's go to our news. Let's see what's happening in the health world. 1 in 3 American adults have experienced symptoms that may mean they're having a stroke, yet very few seek medical attention to be sure. Researchers from the American Stroke Association surveyed over 2,000 Americans. They found about 1/3 of them have experienced stroke-like symptoms, yet only 3% sought medical attention for a proper diagnosis. Health experts report for the best possible stroke outcome, the patient must complete evaluation and treatment within 6 hours of the start of the stroke. The study was a part of the Together to End Stroke project. Folks, the most common form of stroke is when blood flow to the brain is blocked by a blood clot. This clot, or embolus as it's called by doctors, deprives a part of the brain of oxygen, and if the clot is not dissolved promptly, death or permanent brain damage results. But if the patient gets into the emergency room promptly, within 3 to 4 hours, so doctors can administer blood clot dissolving agents within 6 hours of the start of the event, it is possible to completely prevent the damage of the most common type of stroke. And since the damages of stroke are a leading cause of long-term disability, it is imperative that everyone becomes familiar with the basic signs and symptoms of stroke. The most common symptoms can be remembered with the aid of the acronym FAST, F-A-S-T. F for face drooping, particularly on one side, A for arm weakness, S for speech difficulty, and T for time, as in it's time to call 911, as time is of the essence in stroke treatment. So it's face drooping, arm weakness, and speech difficulty. Now, these are far and away the most common symptoms of stroke, but stroke may also display dizziness, trouble with balance or coordination, numbness of the face, arms, or legs, along with a sudden and severe headache. Now, we should also all be aware destructive and disabling strokes are often heralded or preceded by a TIA, or transient ischemic stroke, often called a mini-stroke. These are events that act like a stroke with all its symptoms, but the TIA and the stroke-like symptoms resolve over 24 hours with no residual deficits. Now, it's wise to take TIA symptoms as a warning because a real stroke, with all its dangers, is likely to follow soon. But for now, remember FAST, face, arm, speech, and time to see the doctor. Vitamin A plays a critical role in regulating stem cells. Human beings have different types of stem cells. One type, called adult stem cells, continually divide to replace blood, skin, and intestinal cells, for example, that have short lifespans. However, there is another type, it's specialized stem cell, that remains dormant until called upon to produce specialized white blood cells. These cells are made for only one purpose only, and that is to fight a specific infection. When that infection is cleared, production of these white blood cells should stop so the specialized stem cell may return to dormancy. The German Cancer Research Center discovered that if vitamin A levels are low or deficient, these specialized stem cells continue to make their dedicated immune cells even if the infection has been cleared, possibly leading to the development of leukemia. This is the first proof that vitamin A has a direct impact on stem cells. The study was published by the medical journal Cell. Well, folks, this is a remarkable breakthrough from the German Cancer Research Center. They have found a very special subset of stem cells require vitamin A for proper function. They found if vitamin A levels drop, it increases the likelihood that specialized immune stem cells never stop producing, thereby opening the door to possible life-threatening leukemia. Now, vitamin A is a most fascinating nutrient. It is, of course, essential for life. It's required for acute vision, night vision, the normal growth and organ development of an embryo. It is needed to make membranes for all cells, including blood cells. Without vitamin A, we cannot transcribe our genetic code, opening the door very wide for disease and suffering to emerge. And as we learned from this study, vitamin A regulates our immune system so that we do not overproduce white blood cells needlessly. Now, vitamin A is a fat-soluble vitamin, just like vitamin D, and most doctors are afraid of supplementing vitamin A for fear of any extra A intake may lead to toxicity, just as we feared with higher doses of vitamin D. But is vitamin A really that dangerous? This study shows not having enough vitamin A is very dangerous. That is for certain. Now, over the coming months, we're going to take a closer look at vitamin A. Are we getting enough? Are you getting enough? Is taking a little extra risky business, or is it just plain smart? We'll try to answer all that. Well, stay with us as we learn more about A, just as we have learned more about vitamin D. And it's fascinating, isn't it? Well, that's to come, but for today, we will be taking your calls. Stay tuned, we'll be right back.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. More and more people suffer from asthma. One cause is obvious. The world is a polluted place, and the air we breathe is not always healthy. But other causes of asthma aren't as obvious. Recent research connects a poor quality, high sugar diet and the frequent use of antibiotics to higher rates of asthma and cases of asthma that are tougher to treat. A fast food diet does not meet our nutritional needs. Plus, the indiscriminate use of antibiotics can seriously disturb the delicate balance of healthy microbes in our intestinal tract. So switch to a garden fresh diet that calms and prevents asthma. Eat fruit-like veggies such as tomatoes, cucumbers, and eggplant. Eat yogurt, ginger, turmeric, and take fish oil. Nature holds the answer, but it's up to us to make healthy choices. For Your Health at a Glance, I'm Dr. Richard Becker. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and Cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Welcome back, everyone. It's great to be with you today. Today's show is going to be really special. You know why? Because we get to talk to you the entire hour today. Pick up that phone, dial 800-635-2673. I know this is going to be a great day because you are going to be able to get through. Well, let's start the show by going to North Carolina and welcoming Wiley. Hi there, Wiley.
Hello.
Hello, Wiley. How are you today?
I'm trying to hang in there.
Yeah, tough time, huh? What's on your mind?
Well, I was diagnosed with sarcoidosis around 1975.
My goodness.
And I've taken Plaquenil, prednisone, and methotrexate. Those were the only things that treated this. And recently I was having problems with my eyes, so they took me off the prednisone. And I've been in pain ever since. I mean, I have lesions on my feet, legs, and a doctor diagnosed that as Colitis. But all of these drugs are very dangerous.
Yes,
and,
they are.
And
Well, Wiley, let me ask you, 75, that is like 43 years, something like that, 42 years?
Yes.
And were you on medicine for most of those years?
Well, since 94, I have been taking prednisone.
Yes. What has that done to you?
Well, I lost all of my muscles,
Yeah.
bone problems, vein problems, eyesight, skin problems, lost my teeth.
Did the prednisone control the sarcoidosis?
Yes, it did.
And now that you've had to stop the prednisone, is the sarcoid coming back?
Yes.
So as long as you take a medicine that will ultimately be your demise, you're controlling a disease that would ultimately be your demise. What a mess. That's a problem.
Yes.
So do you have a clear understanding of what sarcoidosis is? Because not many people do, including doctors. It's a difficult disease to understand in a way. It's not really cancer, but tissues build up, the granulomatous tissues. It's kind of like a scar tissue growth. You follow me?
Yes.
And we see it a lot in African Americans. We see it along with allergic disorders. We know that high calcium levels can occur with it. And we know you have to be careful with vitamin D. Most doctors and experts in sarcoidosis say no vitamin D because both vitamin D and sarcoid can raise calcium levels. But there's some growing evidence that sarcoidosis may be a direct result of vitamin D deficiency. And so we have this axiom or long-held belief that vitamin D can be lethal to you, but then there are those who say maybe vitamin D is a cure. And I'm not saying I agree with one side or the other than the fact that vitamin D and the absence of vitamin D is involved in many of our most difficult to treat diseases. The doctors have given you no alternative, correct?
Other than those three.
Yes.
But I do take vitamin D.
How much do you take?
1,000 milligrams a day.
Have you ever had trouble with it raising your calcium level?
Yes.
It has.
Yes.
Okay. Well, I would do this. You know, it can be very disparaging when we're given a diagnosis such as yours, Wiley, and the therapies are toxic. We have this in many conditions. Many of our cancers are this way. Your only hope of a cure is something that may kill you as well. I mean, this is a difficult thing to be in. And many people suffer through the treatments with false hope and on, and we can imagine. And what I always tell people when you're faced with this dilemma, you can't take the treatments anymore. They're clearly not helping you, and your disease is getting worse. No matter if it's sarcoidosis, cancer, rheumatoid arthritis, whatever it is, go back to the basics. Go back to the basics of healthy living. Oftentimes, we're vitamin deficient. Oftentimes, we're consuming foods that we're reacting to, creating an immune reaction. Wouldn't it be something if you found, that you're reacting to gluten in wheat all along, and this is actually a gluten enteropathy, and when you stop the wheat, the problem gets so much better that you're given life again? I mean, these things are possible. There is not literature that I'm aware of that supports that notion specifically in sarcoidosis, but this is what we're faced with doing. You can either succumb and take whatever the disease gives you, which is not good. It's a bad thing.
Yeah.
Or we can take what little strength and resources we have left, and we need to fight. And I don't want to give you false hope, but I want to put you in a direction that has helped thousands and tens and hundreds of thousands of people when faced with desperate diagnoses. Go back to the basics.
Okay.
Improve every aspect of your diet. Supplement your diet, but keep track of your calcium level, because you want to take enough vitamin D to really help, but not raise your calcium level to the point where you have problems. Because a high calcium level can be life-threatening as well. So this means the doctor's got to be involved. Treat for fungus. Do an elimination diet. Supplement all nutrients. Be evaluated for toxicity such as heavy metals. Control allergies. Maybe you're on immunotherapy for allergies. Maybe we take a little bee pollen every day as a first step to calm allergies down. Are we communicating, Wiley? Because I'd like to send you my book, Foundations for Healing, that will give you the notions to follow.
Okay.
And I would also like to send you some Noni juice, because Noni juice is very good. Where's your pain? Tell me about your pain a little bit, because I want to help you specifically. Tell me more about your pain.
Well, it's at my feet, legs, knees, elbows, shoulders, neck.
Could you be gouty? Have you been checked for gout?
I don't have gout.
You've checked for that?
Yes, sir.
Okay. Well, let's put you on a good natural pain program. Noni juice is paramount. I'm going to send you a good supply of Noni so you can start with, say, 8 ounces a day until your pain's improved, and then decrease the amount to whatever is the least amount of Noni to improve your pain. Because, you know, our resources are limited. We can't, if 4 ounces eventually holds your pain, fine. If you need 8 ounces, fine too. But take whatever it takes. Okay. Next is Boswellia. Boswellia is the biblical frankincense. This is an herb. It's a resin from the Boswellia serrata tree that grows primarily in the Middle East, but it's being planted all over the world in arid areas where it can grow. And because of its medicinal properties, it helps with inflammation and pain. And it might help you tremendously. And again, it's been studied at high doses. Take the dose that works. If that's 4 capsules a day, fine. If it's 8, take 8. What else could we? Curcumin is an excellent antioxidant that calms the inflammatory process. Also, the medicinal mushrooms might be of great help to you. Now, remember, medicinal mushrooms, they have a small amount of vitamin D. It's not a lot, but it's, I can't give you the exact, but it's less than 1,000 in a dose. It'd be less than 1,000 units in a dose. But the medicinal mushrooms have immune modulating components that would help control this. Basically, sarcoid is an autoimmune disease where everything's inflamed and you develop scar-like tissue in critical areas where you don't need it growing. So, and of course the book will be coming your way and maybe we can make a difference. Wiley, are we communicating? Do you feel in your heart and soul that we're on the right track with this type of approach?
I hope so.
I do too. I do too, brother.
Still need to take the Plaquenil once I try this, or just to drop it? Well,
that remains to be determined. All of these medicines that they use are highly toxic. You know, the thing that concerns me the most is that 98% of the people truly with sarcoidosis who take prednisone, they go into remission and they don't have to take it for the prednisone for the rest of their life. It makes me wonder as if you've been misdiagnosed all along. If you've not seen a subspecialist, someone who only really sees lung conditions, sarcoidosis, who knows more, has seen 1,000 cases of it. If you haven't seen somebody like that, I would go see them. Okay. Because doctors make mistakes like everybody else. And I don't want to point fingers, but there's no harm in a second or third opinion. That's what I do, Wiley. God bless you, my friend. And I hope you start feeling a little better with this care package. We have a break.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. I'm
Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media, we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For your health at a glance, I'm Dr. Richard Becker. There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, taking your calls the entire hour today. Let's go to North Carolina now and welcome Ava. Hi there, Ava.
Hello.
Hello,
Hi.
Ava. How are you?
I'm wonderful. Thank you for taking my call.
Oh, it's our pleasure.
I've learned a lot from you guys in the past few years, and due to what I've learned from you, I feel better than I did before I retired in 2003.
Oh,
Well, wonderful.
Wonderful.
That's good to hear, but there's a problem that continues. Am I correct?
Yes, sir.
How can we help?
Yes, sir.
What's the problem?
It's a microscopic colitis caused from prolonged use of proton pump inhibitors.
Microscopic colitis. So the colon is inflamed and it's associated with long-term use of proton pump inhibitors.
Yes, sir.
Did I get that right? How are your kidneys?
My kidneys are doing okay, but
Kidneys are
I
doing
have
okay.
a niece who has had a heart transplant that has kidney dysfunction caused by a drop in her ejection fraction caused by a viral cardiomyopathy before she got the heart transplant.
Oh, my. Well, which problem shall we discuss, yours or hers? Let's go with yours, okay? Let's start with that.
Okay.
How do you know you have a microscopic colitis? Did they do the colonoscopy and take a biopsy so we have really good evidence of this, correct?
Yes.
Did they check you for the Clostridia difficile, the pseudomembranous colitis?
Yes.
And that's negative?
Yes.
Okay. To help people understand, proton pump inhibitors are the most effective acid-suppressing drugs ever developed. And they can stop the pain of an ulcer. They can stop the pain of gastroesophageal reflux disease. They can even stop the pain of stomach cancer by suppressing acid very effectively. They're wonder drugs. They work so well that they're used inappropriately at times when people should show better dietary control, keep the weight down, and it's most often inappropriately used long-term for the reflux and heartburn, this type of thing. And they've been allowed to go over the counter, so the problem is that people are diagnosing their own problem. They have the drugs effective, they're available over the counter, they work so well that they continue to take the medicines, and they don't make any lifestyle changes so they can continue to have pizza, hot dogs, hamburgers. And I'm not saying you're doing that, but this is really common, Ava. You know the story. It's all out there. And what we're finding out, when you suppress acid long-term as effectively as that, your intestinal tract changes. We don't absorb our B12 and magnesium as well. It leads to altered bowel flora because our stomach acid plays a critical role in killing off bacteria and viruses that we may get in our food. So intestinal infections skyrocket. Seniors are really plagued with this C. difficile, which is a bacteria that is resistant to most antibiotics. So if a senior, particularly, it can happen to anybody, even babies can get C. diff, but mostly seniors have this problem. If they're on an antibiotic for an appropriate means, let's say you have pneumonia, and you're on the H. pylori, or excuse me, the proton pump inhibitors, it's very likely, I mean, like a third of the people, up to 40% will get this C. difficile infection, and only certain antibiotics will correct that. So that's one problem. But also there's a chemical irritant that can influence the intestinal lining in the colon, and you end up with this microscopic colitis. The key for you is to reestablish bowel flora. We need, are you still taking the proton pump inhibitor, Ava?
No, sir. I was able to get off of it by taking the capsule and opening it and pouring out half the contents and gradually weaning myself off of it.
Look at you.
Before that, it felt like a knife sticking in my stomach when I tried to get off of it.
Well, that's interesting because about half the people who take proton pump inhibitors become dependent, meaning they have a rebound acidity. They make far more acid than they ever did when they tried to stop it. And you must have been one of those, yes?
Yes.
Yeah. And you did the right thing. You wean yourself off of it. Just like if you're on a long-term narcotic pain management therapy and you want to get off of that, if you can wean it off, it's an easier time to get free of it. So we have to treat the dysbiosis. First thing I want you to do is to replace all your nutrients. We can't heal when we're deficient. It's really important that you have B12. I would take 2 or 3 of the sublingual B12 tablets every day for at least a week or 2 to get your B12 level up. And then 1 B12 a day is enough for most people. Some people have to take a B12 shot every now and then to get that level up, but let's start with this. It works for most people. And we need to get your magnesium level up. That is imperative. And so I want to give you magnesium chelate that you take orally, and you would take anywhere from 1 to 4 of these a day. We don't want to take so much magnesium we have loose stool or diarrhea, because then we're washing out again. So start with 1, but increase to 2 or 3 a day as you can tolerate it to get your magnesium level up. The next thing is the active adult multiple vitamin and mineral powder. This is high potency B vitamins. It has a B complex 25 in each dose. It also has a beautiful mineral complex, but not enough magnesium on its own for you. That's why we're giving you the extra magnesium chelate. And it has protein and whey protein so that you assimilate it better. We're going to correct your nutrient deficiencies. And I really have to help people understand, when you're suppressing acid, you will become malnourished. I guarantee it. If you take the acid-suppressing drug for more than a month, you're going to become malnourished. And depending on how long you take it, you will have more severe malnourishment. And the problem with that is, how are you going to heal? When you're malnourished, how are you going to heal? Plus, with the acid suppression, abnormal bacteria gain access to your gut, and it initiates autoimmune reactions like what you're suffering from. So we need to correct that. Probiotics, probiotics, probiotics. Yogurt with every meal. I want to give you the probiotic supplement that you can take a tablet once or twice, 1 or 2 tablets with every meal. I want to give you oil of oregano, mastic gum, curcumin, grapeseed extract, olive leaf extract. These are all wonderful anti-dysbiosis agents, along with the medicinal mushrooms to modulate your immune system to calm this down, and plenty of vitamin D. If you're not taking vitamin D, I would take 10,000 units a day for a month, because it's washing out of you. You're not absorbing. At least you did. We're correcting this situation. If you're not taking vitamin D, 10,000 international units of D3 every day for a month, and then down to 4,000 or 5,000 depending on your size. I want to send you Foundations for Healing. so you can get a better idea of how to use these integrative methods. And you would follow the chapter on irritable bowel syndrome. Now, we only have a few seconds left. Ava, I need to know we're communicating. Are we on the right track? I think we are for you. That's the essence.
Yes.
Good, good. Well, your care package will come. I want to send you Noni, too, because with this dysbiosis comes a lot of discomfort and pain, and Noni will help the immune system as well. So we have a complete package here to restore bowel flora after long-term PPI use. This is a common problem. People need help with it. We'll be back for more. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
Bioinnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings. We're back, everyone, taking your calls the entire hour today. If you haven't tried, pick up that phone and dial 800-635-2673. Well, let's go to Florida now and welcome Linda to the show. Hi there, Linda.
Hi, Cindy. How are you?
We're doing good, Linda. How are you today?
Oh, I'm doing good. It's hot down here, and I was out running some errands. So it just kind of depletes me, so I'm trying to get my, take a deep breath and drink my water and get going again.
So they tell me you had a stroke at one time. Is this correct, Linda?
Yes, I had a stroke 5 years ago, and I've been trying to get myself back together again.
Okay.
And I believe that I'm doing pretty good, thanks to Jesus, but I just seem that I have no energy anymore.
Okay. You know, we have to be careful in assuming that your loss of energy is not due to something else besides the stroke. Are you sure that your blood is strong? There's no anemia, there's no diabetes, no other problem? Have you been checked thoroughly?
Yes, I went to the doctors last year, and, you know, they said everything was good. I got the stroke because I have high blood pressure, and
Okay.
I didn't know it, but the neurologist told me that I had a weakened blood vessel in my brain.
Yes. So you
and that's
hemorrhaged.
what happened.
Hemorrhage.
So-
Are you on a medicine for that blood pressure?
Yes, I am. They finally have got me on amlodipine and lisinopril, and it's doing the job of keeping my blood pressure down now.
Okay. You know, one of the problems, and I agree with keeping the blood pressure down, it's imperative because you'll have another stroke if you don't. Linda, how high was your blood pressure before?
188.
Yeah, that's way too high. And how is it now?
Now it's
Yes.
like 127 over 84.
Okay. One of the reasons why you feel lackluster, dull, slow, is because your blood pressure's down to where it's supposed to be. And don't take it the wrong way and stop your medicines because you'll have another stroke.
Right.
Did you live for years with that high blood pressure? Or was it a short-term thing? Do you know?
Well, it was probably, I would say, 10 or 12 years before, you know, and they couldn't find the medicine to keep it down.
Yes. Are you taking vitamin D? Were you taking it then?
I was not taking it then, but I wanted to thank both you and Cindy for your program. It has been such a blessing to me.
Oh, thank you.
Because, you know, I didn't know a lot of the things that I've learned from watching your show. Vitamin D is one of them.
Yes.
And unfortunately, when you go to the doctor, they don't tell you about those things. So,
Well, you know why, Linda? Most of them
Why?
don't know.
yeah, that's true.
It's unfortunate.
That's true.
And
I know.
you know, doctors know so much about disease, and
Right.
and I don't want to unjustly criticize them because it's a lot. Doctors focus on crisis intervention. That was not my specialty. My specialty when I was in practice was getting people well who couldn't get well. They were doing everything
Right.
possible. They were using crisis intervention medicines and means to handle long-term health problems. That doesn't work.
Right.
That doesn't work. And I am really glad that you're learning from our program, and to God be the glory. It's not about Cindy, it's
Yes.
not about me, it's about the glory of God and sending
That's
this
right.
message to all who are suffering, because we want
Yes.
to help. We want to help people. Well, here's
I
the thing.
thank you.
Your medicines may be making you tired. And
Oh,
it might be
okay.
worth, now stroke can cause fatigue too. There's no doubt about it. And imagine both of them working together, you could really be washed out. That's a real possibility. But when
Right.
people get used to a high blood pressure, what happens is the muscular wall of the artery gets thicker and thicker and thicker, and the intima, or the lumen, the hole in the artery that carries blood gets smaller and smaller and smaller. And so when our bodies adapt to that high blood pressure of 180, 190, 200, it's possible at times your blood pressure was over 200. The blood vessel lumen, the inner area that's carrying the blood, gets so small that you need higher pressure to push blood through. And this is the great danger of untreated hypertension. It can become irreversible, this narrowed lumen. And so when we get our pressure down to a normal level, oh, am I so tired? And you can understand why.
Right.
Now, the danger is if we leave it high for you, it's certainly another stroke. So all of that is to tell you, one, it might be worth looking at a different medicine, but you may have been through that. And the
Right.
other is it might be a psychological adjustment to the fact that I have to pace myself. I can only do so much. Save my energy for the critical times. Give me my afternoons for a little nap and rest. You know, adapt to it so you can maximize what you have. Now, the other arm of this is be sure that we know what's causing the fatigue. It's entirely possible that you could have a B12 level that's low. So I'm going to send you B12. Why take a chance?
Right.
It's entirely possible you could be low in other B vitamins like thiamine or niacin. So I want to send you the Active Adult that has a full B complex 25 in each dose.
Okay.
Other things that will help you just with energy and the brain. Intestinal dysbiosis, the gut makes as much neurotransmitter as the brain. If the gut is off, the brain suffers and we feel fatigue, depression, the blues, stress, anxiety. So I want to send you things that help the intestinal tract. Probiotics, glucoman and fiber, inositol IP6, which is involved in cell signaling in the brain. It helps with feelings of being pulled down. I want to send you fish oil to help prepare the brain. Curcumin, grapeseed extract to antioxidant and relieve free radical stress load on the brain, which can be perceived as I'm tired, I'm fatigued, I don't want to think, I don't want to act. Cordyceps sinensis to stimulate your liver to make more ATP so that your brain can have the energy to feel alive. How about some CoQ10 and L-carnitine? I'm going to send you that. And vitamin D is perhaps the single most important thing you can take. And Linda, dear, can I ask you what you weigh about? 100, 150, 200? Stop me when I'm close. Where about?
Yeah, it's 130.
Okay, that's a good weight. That's a good weight for you. I would take 5,000 units of vitamin D3 every single day and get my blood level up to about 60. Maybe 70 if you can, and that helps to assure proper healing. All of these things, post-traumatic stress, traumatic brain injury, stroke, concussions, any knocks to the head, this is a protocol that helps the brain to heal no matter what the ailment is, and it can help a lot of people. But all the other things apply. And I want to send you foundations, okay? And thank you for your kind words. You know, it gives us the strength and courage to come and make another program because we're not actors and actresses. We're doctors and health education personnel, and so thank you for that. That was sweet of you.
Every day. It's such a blessing. Both
thank you very much.
Cindy.
Thank you.
And thank you.
To God be the glory. Your care package is on the way, and we have a break. We'll be right back. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Is our hope for you today. I'm Cindy Becker. When we struggle with disease and painful health conditions, we can become overwhelmed with negative thoughts. We may even develop depression. The Apostle Paul offered guidelines to help us preserve a positive attitude during times of trouble. He wrote in Philippians 4, verse 8, "Whatever is true, whatever is noble, whatever is right, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Thinking positive thoughts is the first step toward overcoming worry, even depression. Proverbs 17, verse 22 reminds us, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Remember these words of wisdom as you face your health challenges. I'm Cindy Becker. This is our hope for you today.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. We're back, everyone. We have a caller, David from Washington, who unfortunately couldn't stay on the show with us, but we want to help him with his problem. Richard, he suffers from diabetes, and you know how many people suffer from diabetes. He has trouble with wound healing.
Yes, and many diabetics do, and the longer we have diabetes, the worse the wound healing gets. David has been controlling his diabetes with just lifestyle measures, which I applaud. It's a good idea. But there have been times for David where the glucose gets too high. When that glucose is above 200, it inhibits healing. And if glucose naturally goes up after a meal, but it should come down quickly, and it shouldn't go over 200 ever. And when this happens, it inhibits healing. And over time, it permanently changes tissues. It chemically alters tissues, and it all starts in the microvasculature of the capillaries. And when these blood vessels can no longer do their job properly, minor traumas of the day turn into a hole, an ulcer, a diabetic ulcer that will not heal. And if we don't take care of these properly, eventually it becomes infected, or the poor healing spreads, and we can lose toes, half the foot, the whole foot, the amputations to the knees, usually not fingers, but any part can be lost, and it's a real problem. So David has a history of poor healing, and he has an ulcer on his foot, and the doctor told him, I'm afraid we're going to have to take your foot off, and he wants to try whatever he can to make this heal and keep his feet. I understand that. I get that. One of the things they're doing in specialized centers is hyperbaric oxygen. Keep that in mind. Forces, you go into a chamber and it's high pressure. Now, this is not without its problems and its cost, but it is being used for diabetic wounds to help them heal faster. Short of doing that, here's a little protocol that we have found to be quite helpful. Now, every day, and if you can do this twice, it's even better than just once a day. Clean that diabetic ulcer out thoroughly. We have to debride dead necrotic tissue. It is not helping, it's inhibiting the healing. There's no chance of that eschar ever coming to life again. It's gone. Clean it out. And it usually doesn't hurt because the tissues are so damaged around a diabetic ulcer that you don't feel it much. You've got to clean it till it either starts bleeding a little, or oh, I felt that. See, you got to get it down to the active live tissue. Clean it twice a day. And then make this poultice preparation. We take a little jar or a little dish and put about 2 ounces of Noni juice in it, 1 to 2 ounces of Noni juice. Take a beta-glucan capsule, put it in. Open a Cordyceps sinensis capsule, put it in. Take a royal jelly capsule, open it, put it in. Let that dissolve, let that mix. And you may make enough in the morning to do 2 applications, make it easier for you. That's fine, keep it in the refrigerator. Then take your gauze, sterile gauze, or at least very, very clean gauze, and let it soak up that slurry. Apply that to the cleanly, fresh, cleaned, the diabetic ulcer. And do this twice a day if you can. Then wrap it gently. Be careful with any adhesives, because adhesive tape can tear the skin in a diabetic. Find a way to tuck that in and do that twice a day. This composition actually stimulates the release of stem cells that can heal those tissues. It works. It's remarkable how well it works. And you see it in action. You go, people need to know about this. I'm going to repeat it. Beta-glucan, Cordyceps, royal jelly, Noni. Make a diabetic compress, clean the wound twice a day, apply this compress twice a day. Then systemically do all you can to manage diabetes and reverse this advanced glycation end products, the damage of diabetes. And here's how we do this. Alpha lipoic acid, at least 600 milligrams a day. Vitamin C. Take a gram of vitamin C every 3 or 4 hours for as long as you can stand it. Take as much vitamin C until your intestines start to go, oh, that's too much vitamin C, and you kind of clean out. Sometimes we need to clean out. Vitamin C works wonders when we take higher doses. And many people can take 8, 10, 12 grams a day without trouble, and it assists in their healing. The active adult multiple vitamin and mineral powder, for example, the typical diabetic requires 8 times the amount of thiamine in their diet as a non-diabetic. It has to do with what happens in the kidney, the damage to the kidney. We spill out nutrients, we can't reabsorb it from the urine, and we need more than we're taking in. So a good B complex, and the active adult multiple vitamin and mineral has a complete B complex in it. Milk thistle helps the liver to manage glucose levels. All the measures of glucose control improve with milk thistle. Chromium picolinate, similar setting for that. Typical diabetic in America has a chromium level 40% lower than it should be. Curcumin, a powerful antioxidant that stimulates healing throughout. And I would also add the medicinal mushrooms for their beta-glucan content, or extracted beta-glucan. Either way you can do that. This helps recruit immune cells. It helps to turn on the immune system and initiate healing. Also, I would add to this Foundations for Healing, so you have a reference of what to do to help you. There's a whole chapter for the diabetic, and let's do this for 12 weeks, keeping watchful eye for signs of advancing ischemia in the foot, because there's a point where we're not helping us with a bad foot. Sometimes it has to go. I'm sorry, but we're going to try this, but we're not going to be stupid. We're not going to put our life in danger trying to save a foot that cannot heal. But we're going to try. Your care package is on the way. We'll be right back for the wrap-up. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today. I'm Cindy Becker for Your Health at a Glance. Each year, more than 76 million Americans contract food poisoning. Most cases are caused by tainted fruits and vegetables, especially contaminated leafy lettuce. But poultry causes the most food poisoning-related deaths. To prevent food poisoning, follow these simple rules. Thoroughly wash all fruits and vegetables. When preparing any kind of meat, wash your hands, utensils, and work area before preparing any other food. Cook thoroughly chicken and ground meats. Store leftovers in the refrigerator immediately. Look for expiration dates when you shop. If you use reusable grocery totes, wash them periodically. And finally, use spices such as garlic and oregano to inhibit the growth of bacteria that cause food poisoning. Food safety lowers your risk significantly of getting sick. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers 2 products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Richard, this hour has flown by. We just have a few minutes left. Let's summarize the calls.
Well, you know, we've had some good calls today and very kind and nice people, highly complimentary, and we do appreciate that. Linda was having trouble with fatigue, and it's very common to have fatigue, and it's easy for us to assume our problem is from a health condition we've dealt with for years. And I think the most important thing to think about here is those assumptions can really get us into trouble. And sometimes people say, well, the doctor, they just want me in for the business. It's the same thing. Well, you know, not always. The doctor has your best interest at heart. He wants to be sure that it's the problem that you think it is, because you can sure spin your wheels with ineffective treatments when you're not on the right track, right? You don't want to do that. So when we're tired and fatigued, maybe it's because you have a new problem. Maybe it's a new medicine. Maybe you're anemic now, and on and on. You get the point. We can't really make assumptions in health issues. Also, we talked with Wiley with sarcoidosis, years of sarcoidosis. And the thing I want to get across for people in a situation like this, when you've had a condition for years, one, the toxicity of many of our treatments. We can't stop looking for new medicines. Most of our treatments are too toxic. They just are. We need to work better on that. And two, it's never a bad idea to have a second opinion. And if things aren't working out right, even after 30, 40 years of having a condition, get some fresh eyes on the situation. Ava called with long-term use of proton pump inhibitors and the complications it can cause. Folks, the only things you should have long-term is your diet, your exercise, your sunshine, your worship, all those things that are natural to us. There's not many situations where we should be taking a proton pump inhibitor for months and months on end. It will absolutely lead to problems. But there are a few situations where you should take it, and your doctor will help you with that. And diabetic ulcers, it's a nationwide problem. It's not just David in Washington. We have millions of diabetics with potentially millions of foot ulcers, and we can do better. So, interesting program, interesting problems. I hope we made a difference. We'll see you tomorrow, folks. Bye-bye.
Thanks, everyone. Bye-bye.
Next time on The Three, we are joined by Franco Gennaro, the inventor of the revolutionary all-natural patented product that is going to help you have a flu-free fall and winter. Fluvigon.
If you take it right at the beginning, at the outset, within the first couple of days, it goes right to work. University of Florida did a study on it. Of course, it's a patented product, and they came out with the results that showed that it really does work.
Don't miss this exciting edition of The Three, right here on CTN.
Hello, this is Dr. Tony Evans with the Urban Alternative, and I want to join My Faith Votes to challenge all Christians to take your civic responsibilities and your spiritual responsibility seriously. We need God to make his way back to our nation. Let's bring him back. Get a sheet of paper.